I am Josephine Edopaye, DNP student at UMass Global. The aim of this presentation is to research a community and discuss existing services, gaps in services, and resources that the community of focus is located where Northwest and Northeast Washington, D.C. intersect. This presentation will address the following areas: healthcare access, local public health services, vaccination rates, disease planning, health education or promotion, community engagement. Lastly, I will provide a reflection of the services and what is needed. Washington, D.C. has the Healthcare Access Bureau address access to healthcare services through primary care needs assessment and identifying medically undeserved communities. DC also has family programs offering free health insurance to residents who meet the eligibility requirements. One of the community centers serving the area is the Upper Cardoza Health Center, which offers health services are insured and low-income individuals. The services offered include primary care, specialty services in family planning, infectious disease, urology, ophthalmology, dentistry, behavioral health, pharmacy, and social. The second center is the Mary Read Health Center, which provides comprehensive medical care for children, adolescents, adults, and older adults. It offers dental, behavioral health, substance abuse, prenatal services, and care coordination, family planning, chronic disease management, pediatrics, nutrition and wellness counseling, general primary care, and referral to social services. In 2023, the center provided care to nearly 1,500 patients with a focus on eliminating health disparities. Next is the Unity Minnesota Avenue Health Center, offering family medicine, internal medicine, behavioral health and psychiatry, urology, dentistry, teen and young adult services, and case management. Finally, is La Casa Community Health Action Center. This center targets non-English speaking and migrant communities and the homeless. Services offered include comprehensive medical services, primary care, care management, and mental health, and substance services, specialty programs for high-risk groups. The city provides these public health services to the community. There are substance use, HIV services, cancer and chronic disease prevention, and access to vital records. The DC Department of Health has a division of community that deals with food safety and hygiene inspection, compliance investigation, and violations of public safety. Public health services also address the health of school-age children through partnerships with schools. The city has immunization programs, senior services, wellness, mental health services, refugee assistance, animal services, healthcare finance services. The Districts of Columbia Public Health Association also identifies public health concerns such as racism, gun violence, poverty, mortality and morbidity to maternal and childhood condition, substance misuse and sedentary behaviors and physical inactivities. Areas of gaps were services dealing with food access and quality of food in low income and underdeserved communities, public safety intervention, necessary disability and premature death. This slide focuses on vaccination. The national childhood vaccination rate is 93%. The vaccination rate was lower in DC at 78.9%. Neighboring Maryland and Virginia had rates of 89.7% and 94.1%. CDC data indicates DC has higher reported exemptions compared with other states, especially for COVID-19 and the flu shot. In DC, if the family has no health care, children can be vaccinated in community health centers, free clinics, and hospitals. There are free flu shots offered at Walgreens, some Rite Aid stores. CVS stores have minute clinics offering flu shots for $50 to $75. There are also flu shots available through Walmart and some grocery stores like Jack. Next is disaster planning services. Emergency and Safety Alliance provides information about creating a disaster readiness plan, requesting emergency materials, first aid kits, evacuation routes in case of emergency, and preparedness. More information from Fire and Emergency Medical Services Department, Homeland Security, the Metropolitan Police Department, Office of Unified Communications. The DC Office of Risk Management works with organizations to establish emergency response plans. Next item is health education and promotion. The community has different health promotion activities addressing healthy eating, healthy education, and teen pregnancy, sexually transmitted infections, and violence among youth. There are also messages encouraging to prevent seasonal infections, message about mental health and substance abuse, and promotions on health in public transportation, bus stop. Community engagement leverages flyers, billboards, media advertisement, and messages on television, radio, and print, encouraging individuals to be healthy. The messages come from different sources, include the Department of Health affiliates, community groups, non-profit organizations, and schools. Community engagement is also seen through advertisement for classes, events, and activities related to health and wellness. The effectiveness depends on the type of activity. Some traditional media have been obtuse and may not be as effective with younger generations, but leveraging online media portals may be effective. The DC Department of Health has been leveraging Facebook, formerly known, and Instagram to drive community engagement. On a scale of 1 to 5, I would rate the level of services at a 4 overall. There are many services available to improve health, and there is a commitment to making these services free or at a low cost. There are also intentional partnerships with different stakeholders in the community. There are still gaps in services for underserved and marginalized communities. Services for those with physical and mental disabilities can be amplified. Services for the elderly, services for immigrants and displaced families, such as refugees, can be more prominent in this community. Thank you for listening.